Good afternoon, everyone. Gareth Presch, founder, CEO of the World Health Innovation Summit and CEO of the Global Social Prescribing Alliance. I'm delighted to welcome you to our Global Health webinar. And today's focus will be on prevention. We are hopefully able to start to move the dial from managing disease and sick care to prevention at scale. I am delighted to welcome my esteemed colleagues. Let me bring in Zach, Professor, who's joining us from Portugal. Zach, the floor is yours for a short introduction.
Thank you very much. Good afternoon, good morning to everybody. I am breast surgical oncologist. I work in Portugal, and my vision is think globally but act locally. That's why I thank once more the WHIS invitation to check out if we can start implement some changes in health.
Thanks, Zach. And let me bring in Dr. Vasco Fonseca. Vasco,
Hello.
Over to yourself.
Hello. Thank you a lot, Gareth, to bring me here to this conversation. So I'm a medical oncologist. I work in the breast with the breast cancer, but I also work in longevity. I'm doing my research, my doctoral thesis in social innovation, in public health administration, social innovation, and let's share some ideas. Let's see if we can advance a little about prevention of disease, of changing the health systems, and let's see what we can get from this meeting.
Thanks very much. So let me start to frame the conversation here slightly. So first of all, if you're joining us and you have any questions around prevention, I think one of the most important questions I'm going to keep asking today is, why are we not financing prevention? And we have the evidence. What is the bottleneck, and how can we pull the levers to make sure that happens? And I'll be putting that question to my colleagues very shortly. But let's just take stock of where we're at the moment. And globally, WHO reckons that there's about 4 billion people that don't have access to healthcare. This is in the modern era of 2026, by the way. In the UK, I reside in the UK and I live here in the UK. We have astronomical, shall we say, waiting lists at the moment for elective surgery. We have over 7 million people waiting for elective surgery, and the NHS is considered to be one of the best health systems in the world. And we have women who are not able to access gynecology services, and these sort of problems and services are replicated all over the world. Now, we created the World Health Innovation Summit to give people the tools to manage their own health and well-being. And that is exactly what we need to be doing going forward. These interventions are very cost effective. We have demonstrated that on numerous times. And then we'll hear from our colleagues, Dr. Vasco and Zach, about sort of mechanisms and ways and means that we can scale these opportunities up. Hence, the platforms that we have that we can use as tools to enable that change. So before we get into the comment, and we have a couple of comments already coming in. And I like this one already. Preventative health is good economy. Absolutely agree with you, Martin. Health is wealth. And please do join in. If you have any questions, I'll bring them up. And also there's someone coming in. Wow, 7 million. Yes, absolutely, 7 million. But let's bear in mind that this is replicated across most G7 and G20 countries. This is not a problem which is just acute to the UK. If you take Africa as a continent, for example, you will know that millions of people don't get access to treatment. So let's start the conversation off with a nice and simple question for my colleagues. And that is the one that I started. Why are we not financing prevention when we have the evidence? So, Zach.
Thank you. Gareth, the answer and your question and the answer is very, very simple. Let me explain. You said 7 billion in the UK. Global health spending reached 10 trillion in the US by 2021. Okay, mm-hmm. Only a small part of this went to prevention. This was money given. Okay? So why we are not financing prevention? Because it's not sexy.
Right.
It's unsexy, okay? Because you cannot show off results if you have prevention. Who cares? Who cares about the number of vascular incidents you can avoid by controlling the salt in the bread you sell? Who cares? You do not declare this. You declare the number of vascular accidents you are treating, okay? This is sexy, this is fancy, this gives numbers, okay? This gives the governmental efficiency. It's not what you avoid, it's what you are paying, what you are treating.
I absolutely love this, the way we've started to frame this conversation, because firstly, just think of that number, 10 trillion. Okay, this is a huge number. But I think what we're going to be able to demonstrate in the future is, and that's 97% of the budget basically goes on treating disease, 97%. So as we move the dial, you'll soon be able to gather that evidence as we build from 3% up to 50%, shall we say, in the next hopefully 10 years. We'll be able to demonstrate that we've increased output in terms of preventing people getting sick. And these metrics that are used at the moment will be able to be used for prevention. And I think that's a great opportunity that we have. And simply, and we have this in social prescribing, which is one of the anchor programs that we're working on. Let me put that question to Vasco. Vasco, from your perspective, I know you're working in longevity. So why are we not financing prevention?
I think it's a problem from the basis. So we have designed a model to treat health. It's called the biomedical model. So everything is structured to treat disease. We just know to treat disease. And then it comes economics, and economics can value disease. You have this disease, the hospital earns Epsilon. You have breast cancer, you do for a surgery, the surgeon earns X. So when you go to medical schools, they teach you to treat disease. We just know to treat disease. So it's a problem from the basis. We go for the biomedical model. Now we need to come again to the biosocial model. It's a different model of treating health. It knows things like, for example, that if you make vaccines, if you have a refrigerator, that have a huge impact in your life, a bigger impact than to treat disease. So where are the biggest impacts in health? Maybe they are not in treating disease, but the system is made in this way. It's good for everyone. It's good for the nurse, it's good for the doctor, and it's good for people that are in the administration of the hospitals. Everyone, now we need to make some kind of reset of the system, because the system will go to collapse. And this for me is the main problem, is the beginning of for example, if you go to China, they have another system, not the biomedical system. Now they are they are having some types of, because Chinese medicine thinks in the patient in a different way, not as Western medicine.
I think this is excellent. And I'm hopefully, if anyone has any comments on that, please put them in the chat. We'll bring them up on the screen. I know there's a couple coming in. So I just want to say that if you look at the reparadigming that you're talking about here, Vasco, this is a huge opportunity, because let's remember that we can create wealth. Health is wealth. Keeping people fit and well so they have a job is economically viable. And I think we're seeing this now in the UK. For example, you have 2.5 million people with ill health, which is costing the UK government about 7% in GDP. So this does come down to fiscal spend. And ultimately, what we need to be doing is getting structures, financial structures. How do we bridge investors and convince investors that investing in preventative healthcare is economically viable? The same business cases, the same business models that are being used at the moment for our current system need to be inverted and switched towards preventative healthcare. Now, we have some green shoots. We have some opportunities through social prescribing, for example, in the UK and globally. We're working on this, how we mobilize private investment to start these processes through social impact bonds. We engage with investors to be able to put business plans towards these preventative models of healthcare. Keep in mind, we're still going to need the existing system. As Vasco says, and Zach, we are under severe pressure. Hospitals are just overwhelmed. We don't have enough staff at the moment. There's huge problems globally on this front. So let me just go to the next question and start to frame this a little bit more. When we talk about prevention, are we truly thinking upstream enough, or are we still operating in a reactive healthcare system? So I'll put that to Zach.
Yeah, really, are you asking this? It's obvious. Okay, we are hugely reactive. Let me give you some numbers, because I believe in God. All the rest must provide me data. Okay, there is something very fancy they are calling non-communicable diseases. Okay, and it's accounted that it killed at least 43 million people back in 2021. Okay, that counts for 75% of all non-pandemic deaths globally. Okay, that translated, every 2 seconds there is someone under 70s that is dying from one of these non-communicable diseases. Okay, and the majority of these deaths is preventable. What is NCDs? Are the so-called chronic disease. Okay, we are right now coming in a chronic disease crisis, and we have the face to call it chronic. How come it is chronic disease? These type of diseases are there, and they are shouting that they are coming. Okay, it's just that we are not looking to them. We are not looking to the reasons that create this type of diseases. And if we have the capacity to look to the reasons, to everyday life, to alcohol, to salt, to housing, to environment, okay? If we look at these basic factors that each community knows which are, they are coming fully preventable. So they are not anymore chronic diseases, okay? They are there, they are shouting to us, it's just we are not looking to them, okay? Are decades of public health data that we simply ignore them. We're not looking to them. So
I love this. And also there's a great question come in here, and I think this is so important. We need to reset our minds. It's a shift in the mindset that we need to move forward from, prevention. We need to move both dials forward. I really like this from Carlos. Let me just, Vasco, on the mind shift, we do need a paradigm shift. Are we starting to see that within health systems? Like, is the will starting to be there to move the system towards out of hospital-centric care?
I give you a simple idea that I think it can work. Every medical doctor, every nurse, when you go to an appointment, you must talk about prevention. Because this small shift, when you give some advice, you must talk not just about disease, about prevention. You have breast cancer. What can I do to prevention? Then the doctor must say, you need to do physical exercise, because we have data that physical exercise have a positive impact in breast cancer. So this kind of health literacy, for me, it can be a small, big change from the medical community. Okay.
I love this, because this is what I was talking about at the outset. Why are we not financing? We have the evidence. You've just given a great example, a practical example there of the evidence. The evidence exists, and we need to move from this perception of just having pilots gathering more evidence, sticking them on the shelf. We need implementation now. We also need a redefining of how we generate, or shall we say, bring the investment business case towards public health. That needs to be changed. We have experts in public health. We now need to bring the economists closer and the financial entities closer to the health system. There has to be a bridge. At the moment, neither talk to each other. It's crazy to think that in this day and age, the Department of Finance doesn't speak to the Department of Health around health economics, for example. We should be having public health forums where we engage the finance minister with the prime minister, with the Department of Health. All of these should be speaking holistically. I want to ask a question to you both. What does a preventative healthcare system look like in 2030, from your opinion? What would that look like? Zach, to you.
Gareth, what have you done, what we have done in 2010 to check out what will happen in 2030? Have you changed anything? No.
Have I? No.
So, if you want results in 2030, tell me what the work you have done in 2010, because this is what is prevention for. It will not give you results directly, okay? Let me tell you the funniest example, the simplest one, just to have an idea what prevention means. The healthiest generation in the UK is the one that back in 1940, when the government rationed sugar, bread, and meat because of war necessities, okay, came up 30 years after this ration to be the healthiest generation of the UK. So here we come again, and here why you do not get funded for prevention, because the results are shifted in the future, okay? So if we start working today on prevention and on public health, our results are not going to be obvious, but when I operate a patient, the results get ready in 1 month, okay?
Yeah.
So we have to step back and we have to think exactly what I told you in the beginning. We have to think globally, but we need to act locally. If we still want immediate results, we're not going to get them by prevention. What we're going to get are healthiest generations, future generations ones, okay? This is the big problem of prevention, why prevention does not get funded. Because it's not, well, I told you, it's not sexy.
I think, but I do believe that as we make this paradigm shift and we do collate that data earlier, we will be able to demonstrate that prevention works early. And we have some examples when we had our school programs with children for mental health, for well-being. I think that data will accrue itself. Let me ask Vasco, what do you think a preventative healthcare system would look like in 2030?
I think we'll have different areas. For example, what we are seeing in the hospitals right now, we are seeing that the hospitals are not becoming bigger. Now we have the community, the hospital at home. Okay, so we will have different designs of hospitals, and I think in this setting, we'll have a big community, the idea of community, of community. You live in a place that community can work for you and can have a nurse. I think we have some ideas of that, and I think these ideas will become stronger. And this community can give you health literacy, you can have a nurse, you can have someone to contact. So the idea of community, that's something that we are losing over time, will come back again. I think it will be a change. The other change, I think we need to follow the money. Right now, the money is in the drugs, a big part. So the money and the research needs to come for prevention. for example, in cancer, that's my area, in diagnosis, to have diagnosis early in the time. These two areas, I think they will change, and they will give space to the health systems to breast again. Because if everyone needs to go to a surgery, everyone needs to go for complex medical treatment, there are no medical system that will survive. So I think we need these different medical systems with people from economic that can help us to design this idea.
Totally agree. And we've got a comment here. As a functional health specialist who has been working on the ground, helping thousands of people take full responsibility for their health, this conversation and movement is music to my ears. Totally agree. I mean, last year we launched in Bologna in Italy. We had a session, and also we had a session with yourselves. We were launching into Portugal. And I was explaining to people that the scale and need for this is so vast. Like, this really needs to happen in every local community. There's so many opportunities here to create new jobs, to strengthen the health system, to create new services. Like you're talking about diagnostics. We'll need all those home health treatments, bringing the hospital closer to home, but also these preventative models of healthcare. So children's mental health, adults' mental health, elderly care, loneliness, all those services need to be provided. The technology, that all needs to be built. Zach mentioned housing, social housing, homes, all this hasn't been built. Green environment. So there's so much to this. There's educational opportunities. We have millions of people go into the health profession, for example. That needs new training, new upskilling, lots and lots of jobs. So there's massive opportunity. Let me bring in, we've got some more comments before we go to another question. There is literally an army of holistic therapists that are not being included into social prescribing. That's brilliant, fabulous. Reach out to me afterwards. We're very much about inclusiveness. I agree with you. We need to be bringing in the holistic treatments as well. Happy to have that conversation. Venetia Young has come in. Health literacy needs to be improved on doctors and nurses. I like the idea of every consultation containing prevention element. Fabulous. Let me just see from LinkedIn. Education for health is necessary in second-level schools to address the need for the future generation and beyond. Brilliant. This is exactly the conversation we want to be having with the general population. Everyone needs to bring themselves up to speed with this because health is wealth. Now, let me go to the next question. Zach, why is now the moment to shift from sick care to health creation? You probably are really well placed to share this.
Okay, another question. And the answer is quite simple, because you cannot afford this type of healthcare we are providing right now, okay? Global health spending is projected to climb sharply by 2050. And from the other hand, you have the loss of productivity from poor health, okay? That is also expected to rise. So the current model is unsustainable, besides the human cost that is already enormous, okay? So it's very simple. What short view financing system tell you is we cannot afford the prevention because it's very expensive and we cannot include it. And the answer is even more simple. By not shifting now, by not putting now money on prevention, the only thing we are gaining is to defer our debt, because the cost will not arrive today, will arrive in some years, in very few years, because the population is getting older. And we will pay very shortly the bill of the prevention we didn't did in 2010. So if we do not change right now, we get lost. Okay, we have no money to pay this treatment we are proposing to do nowadays. And let's not forget the less rich people, the less rich countries, the so-called low and middle income countries, but they are adopting the Western lifestyle and they are ruining their own health.
Yeah.
Okay. More sugar, more salt, tobacco, alcohol. Okay. What they are doing is just ruining their future health. And this will come everything like a tsunami, and we cannot deal with what is coming.
I totally agree. I think also people need to understand the fiscal pressures that governments are under at the moment, because obviously they're trying to divert money towards defense. Health, of course, is becoming a priority area. I think this is now the time to make that shift. And because, as I mentioned, in the UK, for example, you've got 2.5 million people with ill health, which means when the government goes to borrow money on the markets won't give them money to pay the debt, because they won't be able to service the debt or grow their economy because people have ill health. It's very important people understand that. In the UK's perspective, the NHS will then have to cut services. If it cuts services, people will have more ill health, and we're in a spiral. And this is continuing right across the globe. So it's very important people understand health equals wealth. Keeping people fit and well is good for our economy. Investing in prevention at scale is good for our economy. We have models that work. Social prescribing, for every pound invested, you get a minimum of 3 back. In some of the models that we've demonstrated here in Cumbria, a pound invested, 750 back, 36 back. Very high numbers, but we need to bring that shift to investors and show that we can demonstrate that return. That's where the opportunity lies. We've got quite a lot of questions and coming in. Let me just bring them up and then I'll come to Vasco. Parents need education to support choices they make in the home, to advance children and adolescent health and avail of vaccines and good food choices. 100% agree. We need to go out. The lesson from COVID was that we done really well going out, meeting the public in the public spaces and engaging locally. We need to not retrench back into the hospitals. Agreed. There's more comments. Parents are the sentinels of their children's health and well-being. How can they recognize the signs of advancing ill health like eating disorders or depression if they are not educating in public health initiatives? Agreed. Another common one here: make the NHS a safer place to work, promote retention, stop brain drain. This would have absolutely. The retention and recruitment situation in the NHS is serious, very serious, right across the spectrum. I have witnessed it over the last 10, 15 years, how brain drain has, highly skilled clinicians have left the NHS, but also in global health, we see that problem morphing and repeating itself over and over again. Vasco, let me come to you. We talked about the shift from sick care to health creation. Do you believe health systems prioritize prevention or not?
I think this is not the question, because 1% of for example, the Portuguese health system goes to prevention. 1% in 100, 1%. I think, and it's the same all around the world. I think this question, we have data that say no one is investing in prevention. For example, politicians needs to win elections. So it's very difficult for politicians to take out the money from treating the disease and the problems of disease and to put this money in prevention. This is a serious problem because they need results to the election. So it's difficult. We need to understand the side of the politicians. What can they do? They can change we are spending lots of money in health. So how can we take the money and say the money doesn't go for that, for treating disease, the money goes for treating prevention? It's difficult. It's a difficult question.
Well, I like the way you're framing it also from the political
way now, because I see the other side, because we need to see also the other side of the problem. Yeah. And for the medical doctors, we go and we say, we need to treat the disease. we have this patient, you are not treating, we need money. And the patient said, I have a problem, you are not treating me. So it's difficult to change. We only can change this, it's with communities, peoples with health literacy. We talk with Cristina, with you, Cristina Vaz de Almeida from health literacy. I and Za work with Cristina. And I think the change in some part will come with health literacy for the different players.
Yeah, I like it. There's a lot of good comments coming in here. Let me bring them up and then we can get some comments back. Work stress in healthcare is a major issue. Advance the concept of sustainable work practices to preserve mental health among healthcare staff. Totally agree. The Chinese here, prevention in traditional Chinese medicine is low cost. It begins with raising your arms, chi energy, like it. If we can build a good business case around preventative health, we can solve it. I'm absolutely in agreement. And we do have the business cases. The thing is, we need that critical mass. Vasco mentions the point about your local politicians. We need to engage with politicians at the local level. There's so much opportunity in this space. I've recently met my local politician here to share the sort of opportunities that we've been engaging in around how we bring private capital to support social impact bonds, for example. Let me just go to Zach and let me just touch on the staffing issue, because I think this is really important for people to understand. Personally speaking, I've witnessed so many colleagues over the last 10 years leave the health system. And can you explain to people the sort of demands in the health system now? And Vasco as well, it'd be great to have your insight, because it's very important for people to understand the stress that the system is under, because we always hear about, like, you know, how great the health system and that, but I think we have to be very honest with people. We have a chronic crisis in the health system that we can't retain and recruit our staff.
Of course, because the health system today is not giving the adequate value for our work. So I'm talking about the medical, not let's say there are a lot of healthcare workers. The healthcare system has a lot of people that is working inside, and more or less we have all of us the same type of problem. First is salary. Okay, you mentioned before that the brain drain is a universal, is a global problem, because, for example, what happens right now in the UK? The UK gets drained by the Middle East rich countries, okay? They pick up your best doctors and nurses, and they go for Dubai or other Middle East rich countries. So what the UK is doing is draining Greece, is draining Portugal, is draining Pakistan, is draining India, okay? Is practically what it's a global movement of healthcare professionals. And what the healthcare professional is after a good salary that allows him to live in a decent way, because being a medical doctor, it's a huge investment for families, and it should be paid back. You do not get rich being a medical doctor. Even the best specialty does not make you rich, but you want to live decently, okay? So you have small salaries for the effort that is done, and then you have several other problems like the schedules, the rounds, the huge pressure of the big quantity of people that needs to be attended. So the lack of investigation time, okay, we do not have in our schedule time for us to dedicate to investigation areas. But it's even for a well-paid medical doctor, it's unaffordable, the public health system, because it destroys our own proper health, our mental health, okay? So why should I go on working in a system that destroys me, does not recognize my work? Why? What's the need?
I look, these are points. I mean, I know myself, people need to understand the pressure that doctors, even healthcare professionals, please also understand that the size of the healthcare system is enormous. And we also have a comment here. I fully agree. Working in the healthcare industry is a nightmare here in Germany. I mean, this is
Gareth, let me ask you something. I'm a surgical oncologist, okay, breast surgical oncologist. Have you any idea of what means for me when patients are calling directly or sending emails asking me when are they going to get their surgery?
very
Like,
difficult.
like if it was I that I determine the fact I do not have anesthesiologists.
Yeah. Yeah. No,
Something
I
so
mean,
like this.
these are things also. Don't forget, you may not even have a ward clerk. You may not have someone to schedule these in if you're getting those. I mean, these are things people need to understand the complexity that we're dealing with here. It's very complex system. And I guess what we're trying to elevate here is the preventative measures so that we stop people reaching that stage. The reality is, as you say, for the next 20 years, we're going to have these pressures on our system, regardless, even if we start today. We've got a comment here from Lee. Set protocols, care pathways that require a preventative phase to support to be completed before accessing acute provision. Exactly. Communities design that preventative pause and only. I totally agree with you. I mean, it has to be locally driven. This was part of the programs with WHIS. The whole idea is to create that ecosystem locally. Like you said at the start, act local, think global. It's got to be locally driven. Let me just go to Vasco because I think we've got a number of questions. We were actually going through this quite quickly. And I want to ask you both, is prevention a cost or the greatest investment opportunity in global health?
It's the best opportunity. It will happen. It will happen. I think it will happen. The change it will happen. I don't know if it will happen by behavior change. Now, what I see now, what we have two right now that we are talking, we have two main areas: health literacy and behavior change. I think for me right now, these are the two biggest areas that we can change. How can we change behaviors? How can we empower people with health literacy? So, but I don't know if in the future, in the future, we can have drugs that can change the system. And
Well,
that
yeah,
if we go for that area, it will be different. But right now, for me, behavior change, health literacy, and research in the area of prevention. Research can be in social innovation, but also can be in diagnosis precoces. And also, for example, you talk about that. You talk about green environments. So we know that if you have a public garden near your own, the children will have less obesity. So this thing about how the environment impact your life, it will be very important in the future. How pollution impact your life, the environment, it will be for me, it will be the biggest player in health in the next future.
Gareth, may I say something?
please. Yeah, please. I was going to come to you next.
This question of yours, and this is a very simple way to answer to this question. Take a UK citizen that goes to Ibiza by summer for vacations, holidays, okay, and ask him. So the sunscreen you're buying, is it an expense? It's the same thing, okay?
Mm-hmm.
Prevention is not a cost; it's a huge opportunity to reduce.
I need to make to say something, because the same citizen that went to Ibiza to take sun, then he go to internet, and then someone says to him that you don't need to put sunscreen, because we see lots of that right now in internet. So health literacy, it's very important.
Oh,
What know right now about sunscreen? Because if we go for internet, there are lots of people that say that they work in health. They know a lot about health. That's the problem of new actors in health. They have not been trained as medical actors or health actors. And they are giving information that people follow, and they come to the doctor and say, I listen to someone that says I don't need to put sunscreen.
yeah.
And then big confusion.
Is the noise that comes with health.
Exactly. Well, this is why you need trusted actors, people with integrity, honesty, transparency, particularly in the health space. It's so vitally important that you trust. It's for example, I've had the experience. We're all patients. Ultimately, our families are involved here. It's very, very important. You go to trusted sources. You speak to professionals like yourself, and we trust these individuals because that's what you've trained for. I have a number of things I want to share. We're gonna try and wrap this up in about 5 minutes because we're started to even go over time, and it's been a fabulous discussion already. But I want to share my screen because it's a presentation I gave. I want to give some examples to people who are listening in, and it's on a workshop. I want to show sort of where we are at so people can get a visual. So visually, just look at this diagram. And sort of on the left-hand side, this was an investment forum I gave a talk on. And on the left-hand side is the disease management, the sickness factors. Now, that is currently what we have. Now, as we said, we have over $10 trillion invested in that system. $10 trillion plus. And that system it has about 60 million staff, okay? Now, on the right-hand side is the wellness factors and the sort of preventative model of healthcare that we can establish. This is where we can create millions of new jobs, and this is where we can bring investment to create those millions of new jobs and strengthen the current health system. So I can share that presentation, anyone that wants it as well. But I think it's really important visually, people can see the opportunity where you can create millions of new jobs, strengthen health systems, and improve people's health and well-being. And a lot of this is already proven. We don't need to reinvent the wheel. It is working. So I'll close that. And now I want to come to a couple of final questions that I want to put to you both. So how can we scale prevention, right? This is really important without overwhelming already stretched health systems. I think this is a sort of important piece that we need to have a discussion about. Zach, I'll ask you first. Give me your thoughts.
How we can scale prevention? The answer is once more very boring. We pick up one. Okay, you can pick up just one intervention, but you have to be consistent, universal, and make it affordable to the local community. Okay, WHO showed out 5 best buys, like alcohol, tobacco, salt, etc. So to start making things, we do not need more dashboards. We do not need more documents. We need to pick up what best works for our small community, okay, and apply it in a consistent, universal, and affordable way. Okay, it's not robots, it's not apps, it's not the wearables that make the change. It's small things inside the community, but in a consistent, universal, affordable, and of course, measurable way. We need to get data back.
Yeah.
Just to prove what we are doing. Because let me tell you something in this point. You both, Gareth and Vasco, talked about social prescription. Okay, social prescription, till now, the models that have been applied work for well-being and mental health at a certain point in community sense. For clinical results, we do not have consistent data. Okay, so I cannot tell to my patients that if you walk, you will survive more because you will treat better your cancer. Okay, if you walk in certain way, you will live more because your mental health will be better and your body will become more resilient. Do I make the point clear? Because it's a point that nowadays is a lot talked, let's say. It's under discussion. We do not have consistent data about clinical output.
Yes,
Okay?
I think what we need is a consolidated platform and forum. We're not, one of the things of engagement, and Vasco talked about it, you're talking about these influencers, but we should start to work with community assets that are very publicly driven. For example, faith groups, for example, there are opportunities there to work with trusted community assets that can disseminate this information. We should be engaging with sports clubs, for example. That's a natural synergy, and there's a huge opportunity there. I just want to go to Vasco briefly, come in on this, and then we'll have final comments from you both, and then we'll wrap this session up. There is a lot of comments that have come in. I'll just bring one or two of them up. I wonder if we need to set up a community med schools to educate people, influence business, take responsibility for the health and well-being. These are great opportunities. Through the forums that we had, we've done health melas, summits, activities that are public facing. They provide that opportunity. Vasco, over to yourself. A quick comment on sort of,
I like the exposition of Za, but I will, for example, we need to have a problem, a precise problem. For example, we have hypertension, we have breast cancer diagnosis in advanced time. We need to have one question, one problem. Then all of us, if we are talking about people that are not from else, need to talk the same language.
Yeah.
So that's a big problem, because we use, I think you call it buzzwords, and the words have lots of impact, innovation, but sometimes they have different meanings. So we need to have the same meaning for for the problem, and then we need to know what do we have for this problem. For example, for sugar problem, and for example, that in Africa, the tax of sugar, it's higher than in Europe or in Portugal, because in Portugal, when the companies need to pay taxes if they have high sugar. So this is a measure that can be implemented. For example, a simple measure: how many green space do we have in the city? This measure have impact, so let's put this impact. Do we have people in nurse of community that can help us and that can work as a support for the families that live in an area? For example, I think clear problems, one problem that we can think about, that everyone needs to talk the same language. Then we need to know what we have about that problem. For example, if we talk about physical exercise, we know that physical exercise can lower breast cancer risk, but maybe it needs to be a specific exercise. It's not all types of exercise. So you need to take someone from human nutricity or human kinetics, and you say, what is the problem that we can do for exercise for people that have cancer? So we need to have this evidence-based policy.
And there's some great examples here. Health literacy is absolutely essential.
There we go. When the other idea that Za give to us, it's in the end, we need to know, we have made this program. What happened? We have less cancer. We have the same numbers of cancer. And I think it goes for this way. For example, water that we are drinking, the water is safe. How can we give health literacy about the water? If the water is good for health, They are small problems.
Yeah, I think you're absolutely right. I just want to bring in some of the comments there. So health literacy, for example, is absolutely essential for parents in second level school. Tobacco use, so that's a great example there. There's also the issue of scaling public health initiatives requires prioritization, public health, obesity, adolescents. I think all of these points are very valid, and please, by all means, share this webinar and add further comments. I think there's important points to make that there are best practices out there, so we don't have to reinvent the wheel. Vasco, as you mentioned, for example, if it's a mental health issue, if it's children's mental health, and we have huge problems in children's services, for example, these are targeted innovations that we can bring to the fore. We pioneered a number of programs here in Cumbria that can be used, that can be scaled. I want to ask you both just final thoughts. Do you feel confident? Like, we're starting a process here. Do you feel confident over the next, 3 to 5 years that we will see that paradigm shift from managing disease to prevention at scale? I'll go to you, Zach, first.
I do not know if I am completely confident. I'm sure there is hope, okay? There is hope because we are in a breaking even moment. Now we are realizing, finances are realizing that we cannot afford this anymore. It's not just we cannot afford to pay the pensions. We cannot afford to pay the actual health care, the today health care, the today treatment I need to give. I cannot pay it. So this is for me the turning point. And there is a growing perception of this critical point that we are. It's very funny. The WHO made his public asking money campaign, and they promised that for each dollar given to them, they will return $35 back, okay, by implementing some changes. And what you see now is countries, big countries, dropping out of WHO. I mean, is what I try to say is that I have hope. I believe we are at a turning point, and I believe that the only way we have to go ahead with prevention and literacy, health literacy, is by working in the communities. It passed here a comment like local or community hospital. No, this is not the solution. We cannot have a medical doctor in each community. We cannot have a hospital in each community. What we need is to have healthy communities that do not need the doctor, that do not need the hospital. Okay, then it's another problem what we are going to do with all the fancy hospitals we created. Exactly. But this is the list of our problems. Okay, what we need is to jump in communities and make them live in a healthy way, in healthy housing, with healthy food and affordable way of life. This is what we need to change, but not in a very fancy report, not in a global strategic view. It needs to be local because your community has different needs than mine. I have different diseases in my community. I have different risks, okay? And there is where prevention works, when you get the risks and you go and mitigate the problems.
Yeah, I think, I couldn't have put it better myself, to be perfectly honest with you. Vasco, final thoughts from yourself, just some words of wisdom to our audience who are tuning in. And I'll bring up a couple of more comments as well, because we've got quite a few.
I think there are a lot of people talking about this. Politicians are talking, economics are talking. So I think it will change. Economics, they are not talking a lot. So I don't know if it's the way that it will change. If it will change in this way that we are talking, else literacy behavior change, or if science will bring to us new drugs that are completely different, and we'll see a different way of treating people with drugs. And if the new drugs will have impact in longevity. That's because we know right now that for the first time, we are not making drugs for disease. now in US, they have allowed drugs to longevity. This is the first time that happened, and this can change the system. So I don't know how it will change, if it will change by what we are talking about here, that's humanity, health literacy, social innovation, or if these new drugs will have impact, and what kind of impact they will have. This is a new area that's very interesting.
I think it's very important. We went back to the mindset at the very beginning of this conversation. It's important that we shift our mindset to a preventative model of healthcare. And I think that the funding and that is available for this shift. I think it's very important to understand that we do have investment that is available for this. And we have to get in front of investors and change that narrative. That has to happen from the medical professionals, the professionals who work. I've come from a managerial perspective. When I worked as a manager within the Irish Public Health Service and the NHS, my job was to give you as clinical colleagues time to treat patients, not to be sitting at computer screens. That's very important for people to understand. The interventions that we're talking about here are available. They're proven. They're ready to be scaled. So we now need to bring the finance. We have to talk or shall we say, stop talking about these things and start actioning. So the time for talk is over. Now we need action. We also need leadership. We need people to be brave. We need people to support these initiatives. They have to stand up and be counted. So I'm quite positive. I'm quite optimistic. I do think that the pressure is coming, as Zach and yourself, Vasco, have said. The pressure on the system, the cost is too much. It's costing too much. And we need to now bring these solutions to the fore and scale them up. So I'm excited. And this is the first of our sort of global health webinars that we have. And we're going to run these sort of every month, every 2 months. So Zach will be with me on the next one as well. We'll have other guests. If you have questions, pop them in the chat. We'll answer them. I know some people were asking me, let me just bring that up. You're asking, please share the link to your presentation. I will indeed. I'll share that on the chat as well. If anyone else has any, we'll wrap up this webinar. I have to thank Zach and Vasco for their kind words of wisdom and for joining us today. And look, we're here. We're willing to work for global health at a local level. So we want to work with people locally. If you are watching this, please tune in, join our YouTube channel, but also share it across social media. We need to raise public awareness, speak to your local politician, engage them in this conversation. Very important, because health is wealth, and this is the future, by the way. So for myself and everyone else, I'll just say thank you very much, and thanks for everyone for joining in. And Zach and Vasco, by all means, final word.
Thank you, Gareth. Just something important. Wherever there is a health problem, please include MDs in the solution. Okay, we are inside. We know where the problems are, and we can give tips to how to solve them. Okay, you have a law problem, you go to the lawyer. If you have a health problem, you want to solve it, you cannot leave out the MDs. Nothing else. Thank you for the invitation. Eager to be to the next one.
We'll wrap it up. Thanks, everyone. Join us for our next one, and we'll talk soon. Okay, thanks, everyone.